Hi, so I'm here with Betsy Ladyzhets, and we're going to discuss the hearing last week um, that was held at the Senate that Betsy covered and live tweeted for the Sick Times, which is the relatively new publication, I guess a couple of months old, that she and Miles Griffiths have launched to chronicle the long COVID crisis. So Betsy, thanks for joining me. So what was the focus of the hearing? Why don't you tell us how it came about? I mean, it was just called pretty quickly. No one really was too prepared for it.
That's correct. Yeah, advocates were telling me that they had about a week to prepare, and there was also a federal holiday in there because it was after Martin Luther King Day, and so there's kind of a limited time. But yeah, so the hearings focus was really two things: advancing research for long COVID, with a particular focus on the need for clinical trials and the fact that there are not currently very many clinical trials or at this point any FDA approved treatments for long COVID. So that was a point that got brought up quite a bit. And then the other focus was healthcare access, or what is the experience currently like for people with long COVID trying to go to doctor's appointments or manage their symptoms, and what could the federal government do to improve?
Hmm.
So there was a bit of discussion of existing federal programs such as Recover, the NIH initiative that I have also reported on quite a
Right.
bit,
Which has had
and
problems.
the Oh yeah, and also the grants from HHS to clinics, which I have written about as well. So I
But
felt very poised to cover this.
was the discussion of the clinical trials and presumably of the Recover Initiative, it was relatively somewhat critical of what had or had not happened with Recover. I mean, the senators were on board with the fact that things hadn't gone according to what people had hoped, I guess.
Yeah, I think there was quite a bit of criticism, kind of echoing the criticism from the patient community and from experts that Recover, has spent a lot of time and effort on observational research. And it has both taken them a long time to get to starting clinical trials, which happened late last year, and also that the clinical trials, maybe according to some in the patient community and other experts, are not perhaps looking at the most promising treatment options. Um, yeah.
And so what was the response to that from the senators? Well, first actually was a pretty good turnout from the senators because often they have hearings and half of them don't show up or a lot of them don't come because they have other things going on. So there seemed to be good faith interest, would you say, among the senators?
Yeah, definitely a good turnout. So I was looking this up to write my piece. There are 21 senators on the HELP committee. And according to advocates from the Long COVID Moonshot Group, they counted, I believe, 14 or 15 senators there. And the Moonshot Group also made a concerted effort to actually encourage that attendance. So members of that group and others, who are part of this effort we're calling Senate offices and trying to really impress upon the senators and their staff. This was an important hearing. It was important for them to go. It was important for them to hear the testimony from patients and experts. And according to the Moonshot folks, so they were calling 12 or 50, they were calling 15 senators offices, and then they saw 12 of those like actually present at the hearing.
Mhm.
And then I followed up myself with the other three and got a response yesterday from one of the other Senator Lujan that he was also, or from, I got a response from staff at his office that he also was there. He just had to leave early. So all in all, pretty good turnout.
And
Partially thanks
some of them
to
are
the
doctors
advocacy.
too. Some of them are a
Yeah,
few of them are doctors. Uh, uh, what did that affect the tenor of the hearing? The fact that you had doctors talking and having apparently, medical knowledge of what was going on.
yeah, definitely. There was discussion. Senators speaking from like medical experience. I believe it was Senator Cassidy who was saying like, "I'm looking at PubMed and I'm like pulling up studies," while he was asking his questions. And also, a couple of the senators talked about personal experience with long COVID. Tim Kaine, of course, has
Okay.
previously spoken about having it himself. And another senator, Bob Marshall, discussed like having a close family member who has had long COVID for a couple of years, and he felt very closely aligned with the patient representatives calling for more focus on treatments.
Was there a partisan cast to the hearing? I mean, the Republican senators seemed quite sympathetic, and interested in figuring out how to deal with this. Was there some difference between what you saw willingness on the Democratic senators and the Republican senators of what they might want to do?
I would say there were a couple moments of, different senators sort of shoehorning in their own agendas. Like a couple of the Republicans talked about wanting to investigate the NIH and their potential involvement with, labs in China during the very, very early days of the pandemic, looking at the virus origins. So that came up a little bit. And on the other side, Senator Sanders at one point mentioned, his desire to curb big insurance companies and bring them in for a hearing. So a bit of this sort of policy, you know, ads on both sides. But overall, I would say the attitude of advocates who I spoke to afterwards was that they saw a lot of bipartisan sentiment from this hearing. Folks are feeling optimistic that they can, follow up on this event by continuing to engage with senators and their staff members. And a few of the advocates who went to DC for the hearing actually had meetings following the event. So I think there's a hope that momentum can kind of continue on both sides of the aisle.
And how did it actually come about? I mean, who called it? Was it, how
It
did
was Bernie Sanders.
hmm?
Yeah,
Crazy.
yeah. I don't know too much about why he called it,
Hmm.
but as we were saying, it happened pretty quickly. So
Uh-huh. And there was a bit of a disruption at one point early on, I guess. Can you describe what happened there?
yeah, so early at the hearing, I believe it was right after Senator Sanders finished his opening remarks, there was a direct action by two members of the group Long COVID Action Project, or LCAP. They came to the front of the chamber. They had banners and they were chanting with the key message being declare long COVID a national emergency. And they were also asking for research funding. Their ask is $28 billion at minimum, and talking about a few other things, for example, drawing comparisons between long COVID and HIV/AIDS. And I was able to talk to these two advocates a couple days later. They're keeping their identities confidential using pseudonyms, which are in the story. But they talked about, first being kicked out of the hearing. They were escorted out by security, and then also escorted out of the building, so they weren't able to attend the rest of the hearing. And for them, they were talking about a real need for urgency on this crisis. People dealing with extremely dire symptoms and not being able to attend an event like this. And so I think their desire with the action was to bring additional urgency and specifically highlight this demand of a national emergency around.
Of course, one of the things about an event like this is that the most severely affected can't come, right? I mean, the
Yeah,
most severely ill aren't going to be represented in person at an event like this. Was that
yeah.
perceived as a problem by people?
Yeah, I think definitely a lot of advocates, saw this as a challenge, and that first of all, they were, organizing with relatively short notice when this is a group of people who have energy limitations, and so I think if there were more time to prepare, maybe more people would have gone to DC was one thing that I was hearing. There was also criticism about lack of option for virtual testimony, which obviously would have been more accessible to people with more severe symptoms. And another concern along similar lines was a lack of universal masking.
Right.
So some of the speakers and some of the senators were wearing masks. Many people in the audience, particularly people in the audience who have long COVID, were masked up. But among senators and their staff, it was far from everybody. And so there was a real concern that, politicians talking about the dangers of long COVID could back that up with their actions by wearing masks and by protecting the people who are in attendance during this current moment of being in a surge nationally.
So was this hearing pursuant or, in advance of some action being taken by the committee, or was it just an informational hearing, or was there some kind of proposed, movement forward, or was it just kind of like, let's set the scene, have a hearing, and then we'll see what we do?
Well, it was framed as an informational hearing, so I think now everybody is waiting to see what the follow-up might be. Will there be new policies? Will there be new actions? There are a couple of bills around long COVID that have sort of stagnated in Congress. So maybe one of those could be retaken up, or maybe there will be a new effort. I think that's all it seems up in the air right now.
And I mean, there seem to be a couple of things. One is the research imperative to do clinical trials of possible agents that might
Yeah.
be helpful. Um, and one is people who are sick now, like, what do they do? Like, access insurance, disability, all those kinds of things was that whole aspect discussed as well? I mean, what came up about sort of these services that people need as well as the research that people need?
Yeah, I would say the services aspect was discussed a little bit at one or two points. For example, the senators asked about, SSDI applications, and a couple of the speakers mentioned having trouble with, having trouble getting benefits, trouble with health insurance. Angela Vasquez, who was one of the speakers, talked about paying out of pocket for drugs that she's using, that sort of thing. But overall, I think people who are watching felt that, that could have been more of a focus in addition to the need for research. I think there's this different priorities that maybe people in the advocacy community have potentially some disagreement over, like the focus on really wanting to get research and get treatments versus what can we do to help the people who are suffering right now.
Right,
And so I think a lot of the asks for that relate to, speeding up or removing barriers to disability benefits, cash assistance, like assistance for housing, um, insurance or medical, access to medical appointments, as well as the need for prevention. Like I think, you know, people like Ziad Al Ali, who was another speaker, really clearly said the best way to prevent long COVID is to prevent new cases of COVID.
right,
So there's also the impetus for stronger public health policy, things like mask requirements, improving indoor air quality, more stringent require infection control in healthcare settings, um, that sort of thing.
right. And so, where do you think it go? I mean, what was the general feeling once it ended? Positive in terms of this was a worthwhile thing, or people more disappointed, more didn't get done? And it sounds like overall there was a sense of, okay, this was useful. Now, just a beginning, but now let's see what we can do.
Yeah, I would agree with you. I think people were saying, okay, it was nice to see the acknowledgement. It's nice to see somebody like Bernie Sanders like talking about the debilitating impacts of long COVID, but now we really want to see some policy action. And also, a lot of people were really disappointed about the lack of public health measures at the hearing, particularly the lack of masking
Mhm.
by a lot of people in attendance.
And so, is there a next step called for at this point, or there's not another hearing scheduled? This was just a one-off.
Yeah, I mean, different advocacy groups, I think, have their own sort of internal next steps. I think people will continue to be calling their governmental representatives, making sure that these demands are really clearly known. The asks for more research funding in particular, I think everybody's focused on that. There's also a march in DC planned for this coming March. I believe it's March 15th. So that's another kind of action coming up where people will be making their demands known.
So that's a march, a long COVID support march or a COVID. What is it
Yeah.
exactly?
Yeah, long COVID awareness. So March 15th has been designated by some as Long COVID Awareness Day.
Okay.
And so the plan is to have a march in DC on that day.
Okay. Thanks, Betsy. Anything else you want to add before I?
No, I feel like we hit all the main points. I just wanted to express I appreciated all the time and energy that went into both the advocates who were involved with this and also the people who took the time to talk to me and like reflect after because I realized it was a very busy and exhausting week for many. So
Yeah.
yeah.
Okay. Well, thank you. I appreciate it.